I paused my video update to stop my stress and focus on the treatment of my possible thyroid cancer. But it's been 13 days, no treatment has been done, and I have been waiting for test results in complete panic and more stress. So I've decided to come back in front of the camera for the time being to take some initiative and control of my life back. And also, I hope this video is going to give you some update, and hopefully it will save some time for you if you are also going through the same process. So let's get right into it. First of all, I'm not a doctor, so please just take this as a reference, not a conclusive advice for you to make your decisions. And you can talk with the doctor and make a reasonable course of action together. My biopsy test result is not conclusive. It says it will not exclude the possibility of papillary thyroid carcinoma, which is completely treatable. So I am doing another test called a BRAF test, which is testing if your cells have any mutations. Because if it does, then most likely you do have cancer. This process takes 7 working days. Also, the biopsy test before took about 5 to 7 days. I understand that during this time you will be very stressed and panicky, just like I am right now. But I would suggest you to find a lot of productive things and relaxing things for you to do to get your mind off worrying about the test results. I am fully prepared to have papillary cancer. So now that leaves me with 2 different kinds of treatment, which I didn't know before. What people will usually do is that they will go to the surgical department for their thyroid problems. Usually, if you're diagnosed with thyroid cancer, their only option of treatment is an open surgery. Whether you will have a partial or a complete thyroid removal is decided by your surgeon during surgery when you're completely under. So you don't really have the complete say, and the doctor will not give you a definitive answer before you go into surgery. Such open surgeries are considered a common practice. Open surgery gives the patient a lot of comfort because with the thyroid completely taken out, usually the problems and the cancer goes with this organ that has been removed. But it also does not guarantee that there's no relapse rate because there is always relapse rate. There are cases of patients that had a second or even a third open surgery because of relapse afterwards. If your thyroid cancer is small and it hasn't spread to your lymph nodes or any other parts of your body, then you might be qualified to have an RFA, which is radio frequency ablation treatment. This is a relatively new treatment developed in the early 2000s by South Korea, and now it is gradually adopted by hospitals and doctors in China and Italy. And also American doctors are gradually learning this technique, thinking that they will apply more of this technique on their thyroid cancer patients. It is a scar-free treatment of thyroid cancer. Instead of open surgery, they will insert a needle and using radio frequency to burn off your problematic nodule. You will not have a big scar at the root of your neck, and you do not have to take thyroid hormone pills for the rest of your life and bear with the side effects. And you can still live your life normally because you get to keep your thyroid. But keep in mind that this is a treatment that is relatively new and is very controversial. So you need to think and talk to your doctor in the radiology department. Remember, if you want to have RFA, this is not treatment that can be done by the surgical department. You have to make an appointment with the radiology department. So you have to talk with a radiology department doctor and to see if your condition qualifies, first of all, for an RFA. Because if you don't, then you have to go back to the surgical department and just have an open surgery. RFA and open surgery, they basically bear the same percentage of relapse rate. And also, if you have an RFA, you might have too much of sticky scar tissues that in the future, if you want to have an open surgery, it might be more complicated to do. And I have to choose between open surgery or RFA. I made an appointment with a radiology department doctor next week, which is 6 days later, I need to consult with that doctor to see if I will be qualified for an RFA because that's my preferred treatment if I can do it. So we will see. And I hope this video can give you some insight into some of the not so discussed details about thyroid cancer treatment, and hope this can give you some kind of a shortcut when you are deciding which road you want to take down if it ever comes to that. So again, wish you good health and also wish me good luck. And I will be pushing out videos as well before any treatment is done on myself so I can keep my sanity. So the next video I'm about to put out is the second part of what is stand-up comedy. And I'll see you guys in the next video in 闪颖Blinglish 小颖课堂. Bye.